The moment the German shepherd sat down in the middle of that hospital hallway and raised his paw like a soldier standing at attention, every single person froze because the man on the bed, the one who hadn't spoken a full sentence in 11 months, was already lifting his trembling hand to his own forehead in a salute. Nobody had taught him to give again. If stories like this one remind you that kindness can reach places that medicine sometimes can't, do me a favor before we go any further. Hit that like button. Drop a comment telling me where you're watching from. Share this with someone who believes in second chances, and subscribe to the channel, because there is so much more heart waiting for you here. Now let's go back to where it all began. His name was Walter Grissom, and 3 years ago, he was the kind of man other men followed into gunfire without asking questions. 22 years as a Navy SEAL had built him into something like granite, steady, silent, unbreakable. But the war he brought home with him wasn't the kind you could point to on a map. It lived behind his eyes. It kept him up at 3 in the morning, sitting in the dark of his small house outside Jacksonville, North Carolina, listening for sounds that weren't there. His wife had passed 2 years before his final deployment, and by the time he retired, there was no one left to notice how far he had drifted from himself. The Veterans Affairs Hospital admitted him after a neighbor found him disoriented in his backyard, unable to remember how he'd gotten there. The diagnosis was a blur of clinical words: post-traumatic stress, cognitive episodes, isolation-related, decline. But what the doctors wrote on his chart could never capture what the nurses on the behavioral health unit saw every single day. A proud man locked inside himself, refusing every hand that reached for him. He wouldn't eat unless food was left and the room was empty. He wouldn't speak to the psychiatrists. He flinched when anyone touched his shoulder. The staff had started calling him, gently and without malice, the Wall. Everyone had tried. Dr. Patterson, the unit's head psychiatrist, ran through every approach in his training. Nurse Michael Okafor, built like a linebacker and gentle as a lamb, spent weeks just sitting near Walter's door, talking about nothing, hoping something would land. Nothing did. Walter Grissom had built his walls out of necessity once, to survive things no training manual could prepare a man for. And now those same walls were keeping every ounce of help on the outside. Then, on a Tuesday morning in early spring, everything changed because of a young nurse named Bridget Callahan and a dog nobody had planned on bringing into that hallway. Bridget had been on the unit less than a year, but she had a gift the older staff quietly admired. She read people the way some folks read books, cover to cover, without needing them to say a word. She'd noticed something in Walter's file that everyone else had skimmed past: a single line from an old intake form, scribbled by a caseworker months earlier, mentioning that Walter had once served with a military working dog during his final tour, a Belgian Malinois German shepherd mix named Titan, who had died in the field, saving 3 men in Walter's unit. The dog's name appeared nowhere else in any chart. It was buried the way Walter had buried almost everything. That same week, the hospital had started a modest new therapy program, bringing in trained facility dogs to work alongside patients who weren't responding to conventional treatment. The dog assigned to the unit was a 2-year-old German shepherd named Duke, calm-eyed and impossibly patient, handled by a volunteer named Marcus Whitfield, who had trained him specifically for trauma response work. Bridget requested that Duke be brought to the behavioral health wing, though her supervisors warned her that Walter had refused every group activity offered to him so far, and there was no reason to believe a dog would be any different. She didn't argue. She simply asked for one chance. On the morning it happened, the hallway outside, Walter's room was crowded the way hospital hallways often are. Visitors waiting, staff moving between rooms, a young couple standing near the window trying to process news about a family member down the hall. Walter had been wheeled out to sit near the common area, staring at nothing, the way he had for 11 months. Bridget knelt down in front of him, at eye level, the way you'd approach someone you didn't want to startle. And she didn't ask him a single question, Instead, she leaned in close and said one word, quiet enough that only he could hear it. Titan. For a long moment, nothing happened. Then Walter's eyes, which hadn't focused on another human being in almost a year, snapped toward her face like he'd been struck. At that exact moment, as if the universe had been holding its breath alongside everyone in that hallway, Duke walked forward from beside his handler, sat directly in front of Walter and raised his paw. Marcus hadn't given the command. Later, he would say he still couldn't explain it. Dogs sometimes simply know. Duke's amber eyes held steady on Walter's face, patient and unafraid. The exact way a working dog looks at a handler he trusts completely. Walter's hand rose on its own. Slowly, shaking, his fingers found his forehead, and he saluted, not the dog exactly, but something the dog had unlocked in him, some frozen door finally creaking open. Bridget watched tears cut down the weathered lines of his face. The first tears anyone on that unit had ever seen him shed. A nurse nearby gasped and covered her mouth. A visiting family, waiting to see their own loved one, stood frozen, watching a miracle they didn't fully understand but recognized immediately as one. Bridget had done her homework. She'd spent her off hours calling old military contacts, tracking down a training officer who remembered Titan, learning the exact command. Walter used to give his partner in the field a simple word, spoken low, meaning stand down. "You're safe now." She whispered it to Walter that morning, right after Duke sat, and something in that word reached the part of him that had been standing guard for 11 straight months without ever once being told he was allowed to rest. Over the following weeks, Walter began speaking again, first single words to Duke during their sessions, then full sentences to Bridget, and eventually, haltingly, to Dr. Patterson about the day Titan died and the weight he had carried since. He started eating in the common room again. He started making eye contact. The staff who had once whispered about the wall began quietly celebrating every small victory, because they understood now that Walter hadn't been unreachable. He had simply been waiting for someone patient enough and clever enough to find the one door he hadn't fully sealed shut. 6 months later, Walter Grissom walked out of that hospital on his own 2 feet. No wheelchair, no downcast eyes. Waiting for him in the parking lot, tail wagging against the summer air, was Duke, because the hospital's veteran program had arranged for Walter to formally adopt him, and Marcus Whitfield had stepped back with tears in his own eyes to let it happen. Bridget stood off to the side, not needing thanks, just watching a man who had once trusted no one place a steady hand on a dog's head and finally truly come home. If this story touched something in you, please don't scroll past without leaving a comment. Tell me which moment moved you most, because stories like Walter's deserve to be remembered and shared. And before you go, I want to ask something small but important. Type the word Titan in the comments if you believe every veteran deserves someone patient enough to find their way back. Like this video, share it with someone who needs a little hope today. And subscribe so you never miss another story that reminds us healing often comes in the most unexpected forms.